Bridgman. I'm the founder and vice chair of MindForward Alliance. Some of you already would have met me and maybe heard me speak. I'm delighted to be chairing this really interesting conversation with my colleagues in India today, who I'll introduce in a second. Just wanted to say that we've got over 100 people booked onto this webinar, and I really appreciate the fact that people register and then listen at their leisure as webinars and events like this are becoming more part of people's everyday catch-ups on education around mental health. So thank you all for registering. Thank you all for joining live, those people that to have this conversation and learn with you. We are going to have a panel discussion, so a very common and normal format, but then at the end of it, we've left quite a bit of time for conversation and chat. So if you would like to ask any questions as they come up, we've got a chat function enabled, so please just put your use chat instead of the Q&A for whatever that might be coming up for you, whether it's a thought or reflection, an insight or a question. And Vicky, Ashley and I will try and pick some of those out for questions later. We've got a really, we're very honoured to have this panel, so do take the opportunity to pick their brains on anything work related, but also we'll have a therapist online as well. So if you want some questions around something that might personally help you, that would be really good too. So let me just set a little bit of the context before we get into this discussion. MindForward Alliance is been going for over a decade, and we work with large corporations, mainly in the financial services sector, but not exclusively, to help them build their mental health strategy so that they can sustain high performance through the lens of mental health. So how do you create cultures in the workplace, in large businesses, that foster well-being and enable people to thrive? That's what we've been doing for well over a decade. And some of our work has been growing into many regions of the world, including Asia. And today we're specifically focusing on India. One of our initiatives is a leadership pledge. The MindForward Leadership Pledge has got signatories from a few hundred companies now, where companies and leaders have signed up to say that they are committed to creating and fostering good mental health within their workplace, not just because it's the right thing to do. It's actually about performance, productivity, and enabling businesses to thrive, have the edge over competitors, and look after people, which is really important because people are, if without people, what is business, I guess. When we launched our pledge, we also launched a really important piece of research, which Vicky will put in the chat. Please go and have a look at it. We interviewed 12,000 people in 12 markets and asked them the same set of questions. And I'm not going to go through the entire research because that would make this webinar very boring. But I am going to just pull out a few pieces of information in what I thought was really interesting for the Indian 12,000 people, 12 markets, and then we aggregated the data to look at what the global average was, and then we also looked at specifically each different markets. In India, I was really not surprised, but it still sort of hits the heart here in terms of the prevalence of mental health. So at the time of doing the survey, 69% of people said that they had experienced mental health challenges, and that compared to the global average is 52%, so it's significantly higher. 35% of people said that they had ongoing experience of mental health challenges, and that again was significantly higher than the 21% global average. And interestingly, when we then asked people what is it that was causing them worry and concern, work-related stress was there, their own health was there. But in India, 47% said that they were worried about the health of a family member compared to 30%. I do wonder whether That is to do with the fact that we live in multi-generational households, so we've got caring responsibilities that are nuanced in our culture that is different to maybe other parts of the world, and I wonder whether that's made a difference, and we'll unpack some of that a little bit later. When we looked at the data around productivity or the impact of poor mental health, one of the things that really stood out to me is that 41% of people said that they had difficulty focusing, compared to 33%. And of course, if you think about it, how does mental ill health present itself when we're not well? We don't feel motivated to do the tasks at hand. We can't focus because we've got brain fog. Things play out. But I just thought, again, with 41% of people saying that they had difficulty focusing, productivity is a huge issue here from a workplace perspective, and leaders should be paying attention to that. Interestingly, I thought that the stigma part of the report was really curious to me. So 70 more people in India felt that they would be they were open to talking about their mental health with their line managers. So 77% of people that had experienced mental health challenges at the time of the survey had told their manager, compared to 53% globally. That's really interesting, isn't it? So in a country where we're saying stigma is high, prevalence is high, people are still very willing and open to talk about their mental health. And again, we'll explore some of that with our panel members a bit later on. And then I think, and then leadership, that was the other thing that was a surprise as well. And I think really positive, I think, but we'll see. 89% of employees across leaders about they the organization. So that was the global data. And then only 40% globally leaders spoke about mental health. And here in India, we had 66% of people saying that their leaders had spoken about mental health in a positive way. So there is definitely an interesting story there about prevalence, stigma, and yet in India, there's a real shift in attitude and movement and people talking about it. And I'm really can't wait to get into this discussion with the panel. So let me introduce my wonderful panel to you. We have got Mark Fernandez, Vice President, Human Resources and Head of Organization Development, Employee Experience, DE&I at Kotak Life. We've also got Dr. Rajiv Aggarwal, Senior Vice President, Key Account Manager and Digital Health Strategy, Employee Health and Benefits at Marsh. And then we've got Mellener Coelho, who is Senior Vice President, APAC, Diversity, Equity, Inclusion at Northern Trust. So you've got a powerhouse of a panel lined up. So let's get straight into it. Mellener, I've highlighted some data and not all of it from the research that we did, which is only a year old. Can we just start big with you, given that you've got APAC in your remit and maybe unpack what that means as well. What have you observed in the workplace in terms of health trends and mental health trends across APAC, and how does that translate in India?
So, firstly, thank you so much for having me on this panel. It's always a pleasure to work with MindForward Alliance, especially Poppy and her lovely team. So I'm honored and humbled to be here. Thank you for inviting me. In terms of my role, I look after diversity, equity, and inclusion for the Asia Pacific region for Northern Trust. I'm also a passionate advocate for mental health for several reasons, which I think if I start there, I don't think I'll answer Poppy's question. But I think if looking at the landscape of Asia, and if you ask me what are the top 3 challenges that stand out, I wouldn't say these challenges are unique to India, but they stand out simply because of our sheer population of over 1.4 billion people. Okay. I would say the first challenge is the growing, I would call it an epidemic of loneliness, particularly in Generation Z. And Forbes published an article 2 years ago about this, about the younger population feeling lonely, and quite ironically, in a world that's so hyper-connected, at least digitally today. Earlier, we would say the older generation feels lonely. Find a companion, you'll feel lonely in your old age. Well, the younger people are feeling increasingly lonely. And this is my personal opinion. More than an epidemic of loneliness, I think we're living in an epidemic of unhappiness, and that can have several definitions. We talk about Generation Z looking for autonomy, looking for purpose, looking for well being. Yet, a Life Trends research published by Accenture said that only 1 in 3 people believe that their employers have their best interests at heart. And as human beings, we are wired for social connection. Right from the time our ancestors hunted for food, we spoke about collaboration, being together. And I want to put this in very simple layman's terms. We need to bring back that warmth and social connection back into the workplace. I think that not just the workplace and places. So that to me is the first challenge. I think the second challenge for me is it's interesting you spoke about the research and the stigma, and people willing to talk about it in India much more than in other countries. However, I still believe that stigma continues to be a challenge. We pride ourselves in Asia on living in a collectivist society, groupism, harmony, and yet, if we look at our cultures, most of them are patriarchal, where still even today, boys are taught not to cry, you need to be macho, you need to hide your emotions. And this whole piece about boiling up your emotions and not letting it come out. And I would love to use this, and I'm sure Mark can relate to this as well as a therapist, the metaphorical model of the stress container. It's like stress is in this little bucket of water with a tap, and if you don't, it gets it, you keep filling it with different stressors, and if you didn't have an outlet to let it go, boom, it's going to burst, right? And that's what it is. We don't have an healthy outlets to express our emotions, and that's when you see burnout, mental illness, long-term disability, etc. So to me, that's the second big challenge, the piece on stigma, and not being able, the culture not bringing, especially our children. And of course, things are changing now to talk about our emotions, to identify our emotions. And the third one, and this is nothing personal against anyone on this call who's a therapist or a qualified mental health consultant, but we do see an increasing number of people claiming to be mental wellness advocates, mental wellness experts. Many of them, unfortunately, don't even have a qualification. Some of them are dealing with their own issues and trying to be therapists and sharing their own life experiences. And it's not just lay counselors that I'm talking about. I'll give you my own example. A couple of years ago, I was going through a period of intense anxiety, and I went to my general practitioner, and she diagnosed a medication for me, and she said, take it for life. Knowing me, and I like to do a bit of research and things, and I hadn't started going for formal therapy. What she gave me was something that was highly addictive, would calm me down initially. In colloquial terms, they call the benzos, but have severe, long-term effects. Now, how many people would have that insight to research and find out, what, this is actually not good for you? So, the quality of mental health care would be the third challenge I would identify. And the fourth, it's really the governments, and maybe this is not specific to Asia, I don't have the data to support, but the percentage of the healthcare budgets that government put in for actual mental health care. So, if I were to summarize, I would say the loneliness epidemic, the stigma, the lack of qualified healthcare, and the amount of investment we put into mental health are 4 challenges that India faces right now on this, Poppy. And thank you for the question.
Right. Thank you so much, Mellener. What a great summary and big picture, but also thank you for sharing your personal experience of medication. And again, just to reiterate, it's not, there is a combination of things that help us personally, and all of those are relevant, but when we haven't got enough education, when we haven't got enough services, it's a real challenge. And so thank you so much. Mark, let me come to you, and just, piggybacking on one of the things that Melena said around the economic growth and the generations, how is India's rapid economic growth shaping workplace mental health needs across generations from your perspective?
So to my mind, economic growth in India has provided both an opportunity and a sense of overwhelm in that sense. It's a paradox.
Yeah.
And I think they both play out at different points in time across different cohorts of populations that we're talking about. And the pressure is felt very differently across each of these cohorts. So it's so important for us to realize that on the one hand, the younger generations are dealing with a FOMO, a fear of missing out, and the need for overachievement, the need to be digitally present, the need to be seen as achieving, and that at any cost. So all of this is playing out in terms of burnout, in terms of anxiety, in terms of the need to be seen, in terms of the need to be heard. And it's causing a lot of panic and angst in that population. On the other hand, we have the other side of the spectrum, wherein we're seeing a lot of burnout because of over-engagement, over-identification with work, and a lot of existential crisis, if I can call it that, that goes down to a sense of purpose and achievement. And interestingly, across both these cohorts in terms of age, the younger and the older age spectra, one loves to talk about it.
Yeah.
The other believes talking about it is a matter of shame and stigma.
Yeah.
Right? So that's the reason why I said there's an opportunity, and at the same time, it is a sense of overwhelm because it's happening, but I don't know how to deal with it. I cannot talk about it. And therefore, the ability to deal with mental health interventions by age cluster, by socioeconomic class cluster, by role cluster, by life stage cluster becomes very, very important.
Yeah.
It cannot be a one-size-fits-all communication and intervention strategy, because each cohort in the way it presents and shows up is very unique. And therefore, what they're going through cannot be addressed in a one-size-fits-all. And I think this entire conversation around mental health that we are having, it is not just about varying by intensity across the spectrum. It is also varying by way of language and legitimacy. And therefore, the ability to understand language and legitimacy across different cohorts becomes very, very important. Because without that, you really can't architect any meaningful solution that has a visible impact. Because what energizes one generation could exhaust the other. Poppy.
Yeah, on that, Mark, let me just dig a bit deeper on that. So the intergenerational differences that you've highlighted, and that, the language literacy, I think, is really we haven't got a common language across the world, but definitely not across the generation in any country. And that our data showed that. So pretty much it was consistent across all 12 markets, maybe with a few anomalies, but the older generation in the UK certainly felt like it was private. Like, why are we talking about mental health in the workplace? This is our private issue. Whereas the younger generation were being very bold and open about it. And that's a trend. And even more so in India, the percentages are higher. So this intergenerational difference affecting conversations, what can you give an example of that difference, or how we might think about that a bit deeper?
So to quote examples that I see in conversation that emerge both at the workplace and in therapy, we have a lot of Gen Z talking out in the open about issues concerning depression, anxiety, bipolar behaviors, or issues concerning identity and orientation. And they're very open about it because the need to be heard is very high. They have grown up in they've grown up in a world where digital connectivity has been around for the longest for them. They've seen it through the very beginning. So the ability for them to connect, to see, to be seen, to hear, to be heard is very important.
Yeah.
And they use it to their advantage. The question here is then, am I using the medium to be heard because it gives me the attention I seek? Because the real focus here could be attention seeking. That is guised as depression or bipolar or what have you, right? So words are also being used. Mental health terms and jargon is being used in one way to sensitize people about what's happening by this generation. But in another way, it is also about aimlessly using words like these. And in many ways, that does not do service to the real issue, because every second individual that you speak to is depressed, is undergoing ADHD, suffering ADHD, believes that they are bipolar because of the intensity of their responses. So language, which is where I spoke about sometime earlier, becomes a very, very important medium here, because while it brings to surface what's happening, if it's used aimlessly, it does a lot more disservice than it does service, because then you're normalizing it at the cost of becoming indifferent to it.
Yeah.
Right? So that's one. On the other hand, we have the other side of the spectrum, the boomers and people on the other side of 40, 45, who even today are dealing with the shame of talking about vulnerabilities, because strength in leadership roles or in the family or with regard to who they see themselves in terms of their identity is about being strong, is about being able to hold it all at all times together and being perfect. And therefore, even if I am crumbling on the inside, the need to be seen as holding it together and being strong is so high that it's a it's a it's a bipolarity of sorts. You're existing in two different worlds, and the labor that you are exercising to do that takes a toll on. So, and we see people come back because then this plays out somatically for them in terms of aches and pains and migraines and what have you.
Yeah, and the medically unexplained symptoms in that generation, because I'm from that generation, is really,
we all are.
Yeah, we're all in that place. So I can really empathize with that, and I'm yeah. So let me pause there with you. Thank you very much for those initial thoughts, Marks, and the differences. Rajiv, let me come to you. So Marsh is a leading insurance provider in India and around the world. So, you play a significant role in shaping corporate well-being policies. What initiatives are you seeing that are being embedded around mental health support to, and in particular in India, but not necessarily exclusively, wherever you want to bring insight, that would be really helpful.
Thank you, Poppy. And so feeling good and pleasure to be here. Thank you for inviting me. I think as an insurance consultant, I want to bring that, the insurance aspect on mental health, which is very, very important. And that is the core advisory role, what we are supposed to do and what we do in our lives with our clients. I think Mental Health 2017, we all know, Mental Health Act 2017. 2018, the regulator in the country, insurance regulator into the country, they came up with the directive to all the insurance companies that mental health has to be considered at par with physical health, right? Incidentally, after even 8 years, none of the insurance company is covering mental health in the most holistic manner. I think that's the sorry state of affairs.
Right.
So there is a huge discrepancy in the understanding of what mental illness is all about. Insurers, either they don't want to take that risk, or they don't understand, or they don't want to get into they don't want to deep dive into the area. Okay, this is what mental illness will be all about if you want to cover. So there is a huge protection gap, I would say.
Mm.
So what we have done recently is we have created a white paper, and this white paper, we have done it in collaboration with MPower, the Birla Foundation, and which highlights almost the voices of 150 plus corporate Inc., our clients, alongside 300 plus consumers who have been dealing with mental illnesses. We have shared those findings along with the regulator.
Right.
Just to give you an example, Indian insurance industry always has been a hospitalization industry, right?
Right.
It responds to inpatient hospitalization. Yeah. On the contrary, when we look at the developed economies, outpatient care is the integral part of the hospitalization policy when we talk about medical insurance. Within that, when we talk about mental health, we only talk about IPD, and less than 2% of the claims are actually in IPD. Ultimately, the treatment requirements are more into daycare, counseling services, rehab centers. Unfortunately, none of the insurance company today recognizes rehab centers as a under the definition of hospitals,
Right.
which means that any person who is taking help from these rehab centers, which is the actual most relevant care what a mentally ill person would require, it is not responded by the insurance company. So there is no financial cushioning available, right?
Yeah.
Then there are certain disorders. We talk about substance abuse, I think, which is very, very common in mentally ill patients,
Yeah.
and it's vice versa.
Yeah.
So all the research reports, if you look at research report of Marsh MPower, research report, global health research reports, or a report by Deloitte, every single reports highlights that a person who is mentally ill for whatever, maybe a stress, anxiety, bipolar, or whatever condition it may be, they are prone to substance abuse, and vice versa. People who consume, alcohol or maybe, other substances, they tend to get into mental conditions.
Yeah.
When we look at from the insurance perspective, any intoxication is declined.
Right.
So I don't think insurance companies have actually gone to the grassroots level, and that's the work what we are doing. We have submitted a report to the regulator highlighting the findings of the report, highlighting what are the various parameters which should be and necessarily should be covered within the insurance policies if we want to address this problem holistically.
Yeah.
So that is one aspect of the work what we are doing along with the regulator in the country to make those policy level changes. And simultaneously, on the other hand, as an advisory to our clients, we have started drafting the policy wordings in a manner which becomes more inclusive,
Yeah.
which not only covers inpatient hospitalization, but covers all elements of primary care or a daycare, which is relevant and necessary for a treatment of mentally ill conditions. So I think these are some of the things, initiatives what we have taken as a company for our clients, and also from a regulatory perspective. We are yet to hear back from the regulator, but I think we are committed, and we will keep pushing the regulator to make some of these much needed changes, and that's how I feel we'll be able to make some change.
I love the fact that you are giving so much energy to systemic change, things that are going to actually change the nature of this whole thing and the way that we provide care and support, and actually the stigma that's in the system itself for healthcare provision. So you're definitely not doing yoga and fruit balls, are you? You're not like, and then that's a short term sort of, I guess, a bit of a taking the whole thing about sort of well-being washing that many companies have been accused of, and just yoga and fruit bowls, and now we've done it. You're looking for how do we change systems, and this is not going to be something that's going to happen overnight. That embedding of change is a generational act. And I think there's a theme with everything that you all three of you have said. There's this social media drive around, everybody wants to be associated. There's a real association. I want to be educated. I want to learn about this. But a flip side to that is I'm self-medicating. I'm self-diagnosing, which isn't helpful. There's a seriousness around, well, what does serious mental illness look like? How do we support people? What are the systems that are or are not available for that? And then actually, as influential, I mean, one of the most influential insurers in the country, how do you then, you taking this step is going to be huge for society, but also not just in India, like around the world, because I think there's a huge piece of work to be done, and it's something that we're exploring on creating minimum standards for mental health care provision in workplace, and having a conversation with multiple insurers to go, this is what a minimum standards can look, document framework can look like, and then socializing that in different countries, and partly also because of movement, so employees, your companies are global, Northern Trust is global, Marsh is global. When people are moving around from one region to another, are they still getting the same healthcare provision? And we had a very tragic story of someone who
I think we've lost Poppy. Yeah.
Okay, just give it a moment. Sorry, everybody. These things happen.
the rehabilitation, the community care, all of that isn't easily available if you move from the US.
We lost you for a bit, Poppy. Could you just go back a couple of minutes? Because I think we lost you a minute or so.
Where did you lose me, Mark?
I think all of us did. We lost you.
For about 30 seconds. Yeah.
Okay, so I was just saying, in terms of insurance and standardization, I think it's really important that a group of us get together and produce some minimum standards, because we had a case study, we had a very tragic story of someone who was employed by a large employer, but they moved from one country to another, and the insurance provision, like Rajiv said, didn't cover the rehabilitation, the community care, and that person sadly died. And that's just not okay, because we know that the discontinuation of their mental health care was a huge issue. So I really appreciate the work that you're doing and the work that you've pointed us to. Just continue on that, Rajiv. How can corporate leaders move this agenda, the mental health agenda? I think it's on most boards. I know that because the pandemic ensured health was on boards. That's a legacy and a good one, I think. But how do we make sure that it's a business imperative, and it's a strategy that is in the business rather than a HR issue? Is that something that you've got a thought on?
Poppy, unfortunately, and I don't hesitate in talking and bringing truth on the table, right? It's very unfortunate to see that while there are a lot of conversations which have started happening around mental health, there is a lot more sensitization happened post-COVID era. But still on the ground reality, it is a HR agenda.
Yeah.
And I think that is one of the key areas what we are advising our clients, that mental health is a people's risk. Don't consider it as a wellness agenda. It's not a wellness agenda. It's a people's risk. And when we talk about people's risk, it means it's a business risk.
Yeah.
It has a direct impact on business. So how can this be when business leaders, HR is not a business leader. Business leader ultimately is the CEO and CFO of the company. Mental health conversation has to be a part of the boardroom. Like we talk about ESG, we talk about D&I, we talk about sustainability and all of those things. There are, agendas, fixed KPIs of every company today. I think mental health is something which has to fall into that bracket. I think that's what the change from a corporate side of thing, what we are looking at. Second, on the executional part of it, while There could be, we could talk about it. Ultimately, it has to come from the top.
Yeah.
When the leaders in the organization start investing and start talking about to the employees in the larger forums about
Yeah.
mental health, it destigmatizes the overall issue.
Yeah.
See, today employees still have a fear, they carry that fear, and that's very reflective of the EAP utilization in the country today, right?
Mm.
I think all of the organizations have EAPs deployed in the companies. Maybe just like a tick box, something has to be done. So we have a EAP solution. And when we look at the data across the year, hardly one or two people out of the population of 20,000 employees would have actually reached EAP,
Yeah.
right? So the percentages is less than 1% who utilizes EAP. Uh, Now these data are telling us something.
Yeah.
The other side of the story is that the reports are telling that 15% of the working population actually is suffering from mental illnesses of one form or the another,
Yeah.
with stress and anxiety leading the causes, right?
Yeah.
If 15% of the people are suffering, why don't I see claims coming on mental health, which is less than 1% in our book? If I have to look at, we manage almost about 3 million claims in a year, less than 1% get reported.
Wow.
Less than 1% is the utilization on EAP, which means that people are not speaking up.
Yeah.
So there is a strong cultural change within the company which is required apart from the resources what we deploy as the solutions. So the leaders in the organizations will have to take a lead. They will have to start talking about it. We will have to create champions amongst the CXO communities who talk about mental illness, who talk about openness, who talk about giving that psychological safety amongst in the workplaces. All of these put together can bring that change.
Yeah.
Otherwise, if we keep doing things in isolation or one or two webinars here and there, we
Yeah.
talk about mental health or we have just a EAP, I don't think change will happen.
Thank you. And Mellener, I'm going to ask you about that because we've previously done a lot of work on it together. And I know Northern Trust is a good example of that whole systems, whole organization approach to that. But everything you've said, Rajiv, it totally resonates. We've got a framework at MindForward called Thriving at Work framework, which again, the team can put it on the chat. It's free to download, but it's got 3 pillars and it's an evidence-based a framework with Oxford University, and we've been using it for about 6 years. And if you base your strategy on those 3 pillars and the 10 measures that we have put in there, it's academically rigorous. But one of the main things is, normalize the conversation across the whole organization so that we've got a common language. To Mark's point earlier, we're all talking about the same thing when we're talking about mental health. The second is what support is out there and how is that being utilized, communicated, what's your comm strategy around it? And the third is sustainability. Is it on your risk register at the board level? Where does this sit in the organization and how is it being measured? I mean, this is me simplifying the pillars, but definitely have a look at that. It's a really good resource. And if people want, we do an assessment on companies based on using our framework, which is one of our most important products, and then companies use that to build their mental health strategy, and some companies have done that for 6-7 years now. PwC, Alan, Sherva, there's big companies have been, HSBC have been using that. But Mark, I'm sorry, Rajiv, let me just come one more question to you, and then I'm gonna move to Mellener and Mark again. But why is this so, like, you talk about it with so much passion, like, why is this so important to you? Most leaders, as we've heard in the data, are touching on it, may be talking about it or not talking about it. It's not business imperative. Why is this so important to you?
Easy and a difficult question both, because somewhere I think my passion about mental health is also related to my own story, right? Uh, and the story what I'm going to tell you is pretty older. I'm talking about 42 years before, when I lost my mother. I was 12 years old. In a way, I'm reflecting my age also. I lost my mother with a continued illness of about 2 to 3 years, right? And trust me, I was very small to realize that time that it was probably an issue of mental illness and not a physical illness. But today, after years of my career span, and when we have started working on mental health, we understand, what it is all about. And when I look back and connect all the dots, what my mother went through in those times, I am very, very clear that she did not have any physical illness. She suffered from mental illness, which none of my family members, including my father and all the nears and dear ones, could not identify, did not realize. And from pillar to post, they were walking along, various doctors, various therapies, physical illness related, treatments were going on. But there was something which was holding her back mentally, which nobody addressed. Ironically, the solutions came in terms of, in India is a very religious prone community. And we have something called, okay, this person, if he's behaving differently, is a kind of possessed.
Mm-hmm.
Still, I'm not sure that we have moved out of that. While, we don't talk in the tier 1 cities, tier 2 cities, but if you go into the actual Bharat, not India, which lies into your rural areas or tier 3 cities, still a lot of people believe in all those, possessions and all of those things.
Yeah.
Right. So what I'm trying to say is, nobody in the family could identify the real cause of her problem. It went unnoticed. It affected her physical health to the greatest level. And eventually, after 2 years of continued fighting with her illness, she committed suicide. And trust me, I am mentioning this on the webinar, first time in my life in 42 years. Somewhere that is driving me internally that a lot more should be done in this area, because this has a severe family consequences. You can understand, mother is a fulcrum of the family. And if you lose at a young age of 12, how a person would have managed himself, managed education, career, everything.
Yeah.
So it's been a long, long, very tough journey. And this is my way of giving back to the society, doing something very, very meaningful. In a way, I can contribute so that at least people understand, they are able to relate and differentiate between mental illness and physical illness, and they cannot be looked at separately. My only submission here, when we talk about mental illness, we look at physical illness and mental illness separately.
Yeah.
Have we ever thought a person suffering from a cancer, undergoing a treatment, how severely he's struggling with his mental health?
Yeah.
And people who are having mental health issues, they are more prone to diabetes type 2. So I think everything is correlated. That is where each one of us should start thinking and acting upon. So I think that is what is driving me to do something more meaningful, passionately, and my way of contributing back to the society, Poppy.
Rajiv, thank you so much. I feel so honored that we were able to create a space where you shared this very personal story for the first time in public. I can't say enough how much that means to us, and I can see both Mark and Mellener are reacting in exactly the same way. I think it's such a honor to listen to the things that drive us and how we came about with that. As a 12-year-old person, little person, the impact that would have had on you, on your family, and yet you are here paying it forward. And yeah, the world is better, so much better for the energy and power that you are putting into this. And yeah, we're here to make that amplify that tenfolds, if not 100-folds, with you. So thank you very much for sharing and what you've just said, because I think, well, there's some data, Rajiv, that says something. I can't remember the exact data number and where it's from, but it's something like, for every person that dies by suicide, the impact is on another 36 people, something like that. And I used to work in suicide prevention many years ago, and it was quite, and so when you looked at the multiplication factor of not only the loss in the family and the impact of that, who else it affects, and the mental health impacts of that, it's phenomenal. And you're absolutely right. What if we turned mental health on its head? And when we got diabetes, physical health problems were the integrated service provision and care was thought about from a mental health perspective, we would definitely see things differently. There's a healthcare model, I want to say, in New Zealand, and again, I've forgotten the name of it, but the healthcare provision for the First Nations people is it comes with physical health, mental health, and spiritual health. All three have to be addressed before that person is discharged. And yeah, and I just thought it's an amazing model, and it really resonates with me as an Asian person as well, because of the faith elements of it. And also, just one other reflection that triggered by what you have just shared. When I wasn't feeling very well with depression in my 20s, one of the first things my family did is took me to an imam to get the taweez and water. And so it was quite interesting that at the time, it was very reassuring and soothing. So it is interesting when, in the absence of community services that are clinically rigorous or qualitative, as Mellener put it, spirituality does have a very significant role to play in those communities where faith is a very strong part of our culture, whether we're practicing Hindus, Muslims, it doesn't matter whether we're practicing the faith, but spirituality is a strong role in healing ourselves and our communities and our families. So thank you for that. I'm going to move to you, Mark, on this, and I guess we've moved very powerfully into the things that drive us and our personal impact. But with the amount of counseling and therapeutic, the therapy that you provide in the workplace and outside, what are the themes that you are seeing that are emerging?
Interesting. What I've realized is, while work may look different across generations, essentially what has remained is the same across time has been the emotional themes that has been strikingly similar. And to my mind, three themes are repeated across age cohorts and time. And data also ends up in many ways buttressing that. Theme one would be, I can't switch off. Theme two would be, I don't feel seen. And theme three would be, I'm not sure who I am or what I am outside of work.
Right.
And these three themes have a way of playing out. I can't switch off has to do with my sense of importance. So work gives me an identity. I need to be at it. I can't switch off after hours. I constantly am at it. And there's burnout, there's anxiety, there's a FOMO that's creeping in there. I don't feel seen. And because I don't feel seen, the way I want to be seen, the opportunities that I pick up, the kind of recognition that I seek, the kind of effort that I make to get seen, again, takes a toll on my mental health, because it's attention seeking there, whether we know it or not. And I'm not sure who I am outside of work, because work fills up my identity. Work is an overcompensation for something that is undercompensated in other aspects of my life. So you take work away and I feel a vacuous hollow inside of me. I feel incomplete, right? So it almost makes me wonder when I look at this, that whether our best performers at the workplace are the ones that are best at masking these themes in the face of overcompensation. Puppy.
Yeah, that's really helpful. Thank you. And it is quite in that last bit around who am I outside of work? What is my identity? And again, we're talking about cities and city workers here, aren't we? In terms of people that have got jobs that are in the knowledge industry. We're not, who am I outside of work probably doesn't exist as a theme in the rural community and farming communities, or there are probably other issues there, but I think that's quite important. The other thing I suppose I just wanted to unpack a little bit on this is the attention seeking term, and the term attention seeking. I often talk about help seeking, the help seeking behavior. So actually people asking for help is quite often quite a leap, and particularly for some people, some generations more than other generations. And then we've already looked at, when you do seek help, what does exist may not be the right thing and good enough in the first place. So we've got a problem here. But help seeking behavior is a skill and an art, and learning to recognize and validate ourselves and our feelings, and then being able to actually ask for help is really important. But attention seeking as a term, certainly here in the UK, is got quite a lot of negative connotations around it. And I just wanted to ask your reflections on that. Is help seeking behavior the same as attention seeking, or just a clarification?
Okay. So I used it deliberately, and what I mean by attention seeking here is the need for being emotionally invisible. Right? Emotional invisibility leads to attention seeking. When I feel my emotions are not validated, are not reciprocated, are not acknowledged, the body has a way of expression. And if you can't express it in one way, you express it in another, but express it you must, because that's who we are as social beings. And attention seeking here is not, I would not label it as good or bad. I would label it, in psychology, we call it as a stroke. It's a stroke that we seek, because if I don't get the positive strokes, I will seek it through negative strokes. But strokes I must have, because in the absence of it, I'm emotionally dead.
Thank you. That was really helpful. And I think just that clarification of it's not a judgmental term. So what we're talking about is very objective. And I think that's really important for people listening to hear. Mellener, can I come back to you? And I want to pick back up the point that that has already been made by Rajiv around leaders and the honesty with which, it does sit in HR. It does. And HR is such an important part of every organization, but it is there to serve the organization. And when we're looking at these strategies that we're talking about, we do need leaders to be thinking about, where does it sit? Is it on the board risk register, etc.? So we've covered that. But I think where I wanted to come back to you is two things really. I'll ask both the questions in one go. So first of all, how do we can we truly have psychological safety in the way that we've been talking about, help seeking behavior, creating a culture of human flourishing, people asking for help, EAP utilization, without a strong diversity, equality, and inclusion strategy? And then the second part to that question is, what are the tangible things that leaders can do to foster this?
Thank you, Poppy. Great question. I was smiling when Mark was speaking when he spoke about strokes. So the reason I was smiling is, in the spirit of being candid, and we talk about the role of leadership. I think, and if you ask me what does good look like when it comes to mental health, this is something that's should not be a pet project of HR. It has to be integrated in your leadership agenda and your leadership strategy. Now, for that, I think we need more and more leaders to be, very simply put, more self-aware. Okay. And, all of us, every single one of us, whether we want to admit it or not, come with some sort of trauma. or schemas that we've developed in our childhood, which have not been expressed, as we've grown into adults. And I've seen this, including myself, play out into the workplace when it's not addressed.
Yeah.
So I live with anxiety, and years ago I used to be a very strong perfectionist, and this impacted my leadership style. And today, when I look back, my team says you're such a good leader. I'm like, really? 5 years ago, you'd have hated me. You'd have just probably raised a harassment complaint about me, because I was very similar to the type of people that Mark was talking about. I want to be seen. I want to be noticed. Everything should be right. Where those emotional unmet needs were so strong, until I've worked with a therapist for many years, and dealt with some of these schemas, which I think is the best thing that happened to me today, and why I'm so passionate about mental health. So to answer your first question, Poppy, I think diversity, equity, inclusion strategies and psychological safety are inseparable. Both one links to the other. Inclusion forms the foundation of psychological safety, which means that your team is as safe as the least safe member in your team. And I think when we look at a team, when we look at people, it's very similar to the analogy of an iceberg, right? What we see is just we're scratching at the surface, but the multiple dimensions we all have, not just in terms of the way we look or sexual orientation or gender identity, but even the experiences we have, our religious affiliations, our spiritual beliefs, and as you rightly said, in the Asian context, our education, the social mobility, aspect, all of that interplays, and that's really about our whole self, or our authentic self, or best self, or whatever word you want to call it. That's what we bring to the workplace. So if your D&I strategy isn't addressing all these different moments of truth or microcosms of who we are, then you really can't create that safe space to bring yourself to work. And I think in terms of leaders, like I said, you have to integrate this into your leadership strategy. What does that mean? Two things. One is, leaders could have a policy. They could integrate mental health as part of their culture, talk about the awareness training, celebrating days. All of that is good stuff. And a lot of the things that we've done, there's a saying, right? An apple a day keeps the doctor away, and prevention is better than cure. So a lot of our work on mental health has been very curative, be it the Zumba, the yoga, the fruit bowls. I have nothing against that, and the mindfulness sessions. Okay, all of that is great stuff. But you got to address the root problem as well, right? So I think, and that's so many things to addressing that root problem, comes the prevention piece, and that's where leadership has a role to play. Most importantly, I think leaders need to create that microclimate or that element of trust. I'll give you an example. I was talking to a friend of mine, and she had to organize a big event. And this poor girl was so stressed. And she said, I'm stressed. And she kept quoting the names of two leaders in her organization. And she said, what will this one say, and why say if the event doesn't go well? Now I'm going to use the word, to her good luck, both the leaders weren't there for personal reasons. The event went on fine, but her relaxed, joyous attitude was what caught my attention. And what I keep hearing is, why is the corporate workplace becoming more and more toxic? So to address that, I think that self-awareness piece from leaders is so strong. And the whole piece on psychological safety, that doesn't mean you've got to be nice to everybody. That doesn't mean you can't have stretch goals and high performing cultures. But it also means that you've got to admit when you make mistakes, ask questions, seek feedback, and just say hello to somebody you don't even know, not pick the usual suspects every day. So create that microclimate of trust, have more self-aware leaders, and have it integrated into your leadership strategy. That would be my three things I would suggest.
Yeah, and the concept of psychological safety, it's not, it's if people can come to you and be open about what's going on in their worlds without judgment and negative impact on their jobs and their days, then they're also going to bring innovation. So when you create psychological safety, not only does it deal with possible big problems ahead of time when it's a small problem, and it has but it also means that it creates safety where people bring their wildest ideas, right? You know, that idea that they don't want to talk about because they feel like they might get laughed at, but actually they bring that in this space. And that's innovation. Like some of the most revolutionary things in the world that change the world has come from people having a random wild idea that they thought they could bring to a group, and it was tested and it was welcomed. So in psychological safety isn't just prevention, it's also an enabler of growth and creativity, and stops you making mistakes as well. When you ask for honest feedback from your team on a regular basis on a project that might be your passion project, but actually it's not going to land anywhere, listening to that, as hard as it might be, is going to stop you making a terrible mistake, but also investing in a product or a development that is just not going to land because, you know, frankly, I'm not in tune with what the 20-year-olds in the organization need and want, and they're the future. So I think there's so much in that. Thank you for both of those responses, Melena. Really, really helpful. Rajiv, can I come back to you on the systems conversation and just to say to everybody, look, we're in the last, we have scheduled this for another 25 minutes or so. So if you have got questions, we'll take them. If you have got reflections afterwards, and there's questions that you think about afterwards, drop us an email and we'll get, you know, one of the team, Mark, Rajiv, or Mellener, to respond to them or connect you directly if that's something that you would like. But I understand, you know, there's a lot to take in, so I appreciate that there may not be lots of questions at the end of this directly, but don't miss the opportunity if you've got us here. So do ask, and put it in the chat or the Q&A, and somebody will highlight it in a moment. But Rajiv, can I come back to you on the systems change? And you touched on this earlier, and actually all three of you have touched on this a little bit. Given India's population growth, it's one of the fastest growing economies in the world. It's just like there is so much happening in India at the moment. The increasing demands of the workforce, what changes do you believe are necessary to scale mental health accessibility in corporate environments? And I know you've already talked about writing to the regulators, but is there anything more that you think we should be thinking about as leaders?
You know, I think there are two sides of it. One is on the regulatory aspect, what I've spoken earlier. Second is on the policy design aspect, what we are already working and we are drafting and advising our clients with the holistic mental health insurance policy wording, so that at least financially the treatments are being responded by the insurance policy. These are the two key areas from a regulatory and a policy framework side. From the corporating side, I think 2, 3, 4 things, you know, which I would like to highlight. One is it has to be a boardroom discussion, what we spoke about collectively here. Companies need to identify leaders within the organization who could champion and spread awareness. Third important element is, I think, the line managers training. While there is a leadership talk, the functional managers, whether they are equipped enough to identify the initial behavioral changes in their immediate reportees, is one area which probably can bring a very different level of change.
Yeah.
And I think that is where, when we talk about toxicity in the corporate environment or a work culture, it is not necessarily means that the organization itself has a culture of toxicity. It is many a times, it is the manager who brings that toxicity for the people, right?
Yeah.
And the ability of these managers to identify and understand mental illness at a primary level is very important to address it at a ground level. I think that is one important area where we also talk about this, creating first aiders, mental health first aiders within the organization, who are actually the change makers, who can drive initial conversations, who can give direction to the employee in case the severity level is higher, on the pathways, on various resources, which company has already deployed within the system, who can direct these people in need. So I think that is very, very important aspect what we should look at, from a systemic change perspective. Next one is, I think our advice to the companies would be that start looking beyond EAP solutions. EAP can be there. I'm not saying that there is a need of shunning them out. Not at all. It can be there. But I think today we come across a lot of new age solutions which are artificial intelligence chatbots are there, which are built on CBT principles, which are totally anonymous, where employees or members can engage 24/7, where there is no fear of any judgment or any biases, any fear. I think those kind of solutions are available, backed up by uh, the scientifically trained, academically trained physician, psychologist. And I think Melon made a point that, today we are living in a world where we see a lot of untrained, academically untrained people who call themselves as counselors. So we have to be a little mindful. So we need to have a solution which is a digital solution, which is a combination of uh, artificial chatbot along with clinically driven practices run by some of the top psychologists or psychiatrists of the country, right? Because anyways, in India, if you look at another problem, what we have not talked about is we only have 7,000 psychiatrists in the country of a 1.4 billion population.
Yeah.
So how do everybody, and these are ailments where psychiatric help may be required. And so my advice would be, if a psychiatrist is required, don't hesitate. Like we go to an orthopedician or we go to a diabetologist, there is no harm in going to a psychiatrist and seeking help. So openness of people to look at psychiatry from a health standpoint is important rather than thinking, oh, what has happened to me? Why should I look at a psychiatrist? But 7,000 or 8,000 psychiatrists in the country, do you think they can physically be available for such a wide number of people? So digital is a solution. So I think digital enablement is one important area where corporates should start looking at beyond EAP. And last but not the least, I think we should have a specific policies around crisis and trauma management.
Right.
Like we talk about primary health, but on regular solutions, and we see in our clients, we see that there are suicides, there are deaths happening because there is no availability of trauma management or crisis management. So can these kind of critical helplines be available for access for the employees? I think it's very critical to have. I think these are some of the systemic changes what we should start planning and looking at implementing in our organizations.
I love that. And at that last point about conflict or crisis and drama management, I think we're definitely seeing some of our members put in sort of training around conflict management for line managers. Like that's something, and it's almost sitting side by side the mental health first aid, because it's like, well, there's a people's emotional reactions to, I mean, it's a lot going on at the world right at the moment. There's a lot, the geopolitical global issues, the financial crises in different markets, there's a lot going on in the world, the existential crisis around the planet, the next generation have got a lot to worry about. And then on top of that, if you've got the accumulative stress accumulation of the external environment, and then you've got your work environment, which may or may not be toxic, but it seems like in the corporate world there is toxicity seems to be a thing that every younger people are definitely calling out more. You've got the potential for more and more conflict. And in our survey, it did show that when leaders spoke about mental health, when line managers were trained, when there was peer support available, actually there was less irritability. I think, I can't remember the term, but it was less irritability amongst peers. The team dynamics in an organization were improved. So if not productivity, actually people's performance is going to be better because the culture within the organization is being run by managers and who are trained. And I think the other thing I think is, managers have got a lot to deal with. and that, you know, everybody's saying, oh, managers need more of this and less of that and more of this. And actually, we do need to equip managers, you know, as a responsible businesses, we need to equip managers with the right skills to be able to lead and manage and grow teams. Like, it's not everybody's natural forte to be able to do that. And Mellener spoke about herself 5 years ago, and now that's growth, but that's taken intentional development to actually get there. But if we actually put that in for line managers without assuming that people can do it just because they've been promoted because of a certain skill that they had in, you know, they performed really great in this area, and then they've got management responsibilities because of promotion, and actually it doesn't work. It causes quite a lot of conflict. Mellener, we're coming almost to an end now, but in terms of my questions at least, what inspires you? What examples have inspired you? You've been around doing this stuff for a while.
Okay, there are two things that inspired me, but I'm going to just take a slight trajectory to your question and share something, that a documentary that I was watching last week that really touched my heart, all the four ventricles of my heart. So it was a mental health institute in the US. I think it was in India, and I can't remember the name. The documentary was by this British journalist. I can't even remember his name now. Okay, I'll blame it on brain fog. But anyway, what really touched my heart was, I've always been passionate about mental health for women. And in the US, they're seeing an increasing number of women being sort of criminalized for serious crimes because of their mental health conditions. Some of them even, you know, resorting to killing their own children. And I've watched these documentaries repeatedly, and while it is pessimistic, sad, I still continue to watch them. I don't know why, but this one touched my heart. So what the institute has done is, earlier when women would come and be admitted to the institutes pregnant, the state would take away their babies when they were born and give it to foster care. But now they've created this little childcare center within the jail, and women can actually keep their children with them while they're still in prison. And you could see the women crying out of joy because they don't have to give, their babies back. I may have murdered my husband, not me, but one of them said that, but I'm still human at the end of the day. And the fact that I'm allowed to keep my baby struck a chord with so many of them. It struck a chord with me. Why did it strike a chord? Because in this increasingly toxic world we're living in, there's still elements of human kindness out there. So for me, that's one thing, that what good looks like. I wish the other mental health institutions around the world, the Broadmoors and the ones in the UK, would, you know, follow suit. The second thing was, I think, the power of storytelling. So stories have sort of deeply engage with the emotional side of your brain. They talk about the power of vulnerability, and they're also used to describe aspects of mental illness that are difficult to describe, especially in our society where, you know, the focus is on the group. Talks about the power of vulnerability. Personally at Northern Trust, we started the This Is Me campaign, which was started by Barclays years ago, and it was super successful. It also helps us bring in, the intersectionality of mental health and diversity. So neurodiversity, people from the LGBT community and mental health, women in mental health, men in mental health, and so on. And the third thing that I think good looks like, and, you know, the risk of sounding boastful, again, it's something that we introduced at Northern Trust a couple of years ago. It's about targeting your campaigns to your audience. So we talk about the Gen Z and future generations to come. So we wanted to introduce mental health awareness in a fun and engaging way. So we worked with this organization called the Mitra Trust, and we worked together to develop a campaign licensed by them called Sky is the Limit. So Sky is a cloud. It's this fictitious character who starts a mind gym with 4 animal characters: penguin, an owl, a dog, and a sloth bear, talking about different aspects of mental health. So mental health, stress, anxiety, and depression. And we didn't use men and women. We didn't use Lakshmi, Sita, Rohit, or Mellener because we didn't want to have stereotypes. But we used animals. And I cannot tell you how popular it was. I used to get messages like, I'm feeling a bit like Owly today. I love doggo. And people actually started talking about this. And we took it a notch further, and we introduced constructs of positive psychology with themes around kindness, forgiveness, gratitude, and resilience. And people started having competitions within their teams. This is gratitude day. This is, somebody actually called me and said, thanks to Auli, I've forgiven my mother for shouting at me today. So so all I'm saying is, without those fancy things, like, we're doing a lot of great stuff, but keep it simple. And I'm a huge lover of animals. They play a huge, they have a fantastic impact on your mental health. I call my little kitty cat my therapist. That have campaigns that are targeted to your audience. So a long answer, Poppy, but just my
all
thoughts.
inspiring. And I think the story around the sky, that model is really helpful, because sometimes it all can feel a bit serious, like there's lots of models and there's lots of seriousness in this, but actually we can shift the whole thing outside of psychological language, clinical language, medical language, and humanize it and normalize it. And Asian cultures are profound, and just there's so much there that we can draw upon in terms of the richness of our cultures to actually bring some of this to life. We don't have to adopt a westernized model of thinking about all of this stuff. In fact, I advocate that we don't, and we start where the heart is and with the nuances that are within our cultures. My last question, and I can see we've got a couple of questions on the chat, but I want to really build on where Mellener's sort of brought it to anyway, but build on the personal element of this. And Mark, I'm going to come to you on this. How do we, can you share with us a very a simple tool, something that we can all use to self-regulate, self-manage? So there is help-seeking behavior externally, but how do we self-soothe? Is there a tool? Is there something that you teach or you advocate that we might be able to learn from you today, and leave everybody that's listening with that?
Right. So, Poppy, a lot of mental health has to do with resilience, right? And far too often, we make resilience about rugged individualism. But it is far from it. Resilience isn't rugged individualism. It is regulated self-awareness. And to ensure that we have regulated self-awareness, I think there's a very simple framework which, when put to use, provides language, legitimacy, and in many ways, self-leadership to go through what you're going through, right? I would call it the name it, the claim it, and the don't shame it framework. Name it, right? Claim it, and don't shame it. So the name it is all about emotional literacy. Far too often, when we don't know what we are feeling, it adds to the brain fog, it adds to the anxiety, it adds to a lot of confusion to the inner world that we experience, and therefore it plays out differently in the outer world. So what am I really feeling? Am I able to put down a word, a feeling, an emotion, a sensation to it? Becomes very, very important. Therefore, the name it. The claim it is about making room for emotion. Once you've named it, can I make room for it? So it is about telling yourself that if I feel it, it is valid because I'm human, right? And now I also have a name for it. So it tangibilizes that which is intangible and that which is not concrete for you. And that gives us a lot of control over what we are going through. The fact that you're able to stake claim to it. And finally, the third is about don't shame it. This is about self-compassion. Because at the end of the day, if I need support, asking for support isn't something to feel guilty about, isn't something to hide, isn't something about saying it's making me less of a person or will be making me seen as less of a person. So it's very, very important to understand what name it, claim it, and don't shame it is, because at the end of the day, you really can't manage what you can't name. And you can't heal if you end up shaming it. You can't manage what you can't name, and you can't heal if you end up wanting to shame it. And I think if that's the mantra we follow, I think it gives language, legitimacy, and self-leadership to go through what we're going through.
Brilliant. Thank you. You three have been absolutely brilliant. I mean, it's morning here, and I've done exercise, so that's I've done my physical health stuff, and then I've done this, which is my brain and my heart and my mind is completely saturated with new knowledge, thinking, and a lot of inspiration. And I certainly feel like you've all treated this session. We've been very kind, I think, collectively, and very generous. So I hope that the audience and the listeners who are going to be participating after this session as well really feel that. I've got two questions on here, so I will, if you look at the chat, I'll read them, maybe that's what I'll do. So we've got a question from Catherine Mwaniki. The issue of help seeking versus attention. Seeking is an important concept. I am wondering, what are the effects of emotional suppression, particularly in the workplace, as this is not considered as a legitimate place to bring your emotional concerns, yet we ask people to bring their whole selves to work. Who would like to take that question? Shall I? If you're not going to volunteer, I'll just pick one of you. Rajiv, do you want to go with that one? Because I think it relates to what you were talking about earlier anyway, in terms of the workplace culture becoming a one that is welcoming of people's emotions. And this, what I think Catherine is saying, on the one hand, we're saying bring your whole self to work, and then on the other hand, we're going, actually, we can't talk about our emotions at work.
I think my view is, when we say that, you have to
Rajiv, I can't hear you properly. Is that just me? Maybe.
No, we can't hear.
Yeah, so
No. That's okay. I think while you sort your tech out, maybe Mark, do you want to have a go at that question?
All right. So I was pondering about that question as I saw it on my screen. And I think it's very important to understand suppression at a very layered level, because it's a question that calls for a lot of delayering, because suppression happens both at an individual level and at an interpersonal level. So if we understand emotional suppression at an individual level, individually, suppression would play out in terms of burnout and fatigue.
Yeah.
It would play out in terms of anxiety and depression. It would play out in terms of a lot of reduced psychological safety, and eventually leading to detachment and disengagement. At an interpersonal level, how would it play out? It would play out to breakdown in trust, a trust breakdown, loss of connection, and most importantly, passive aggressive behavior and low empathy. And very often we see this in reporting relationships, managers who have absolutely no empathy. We see trust and connections break down in teams. We see a lot of passive aggressive behavior in terms of how people push back. And in many ways, these are cries for help. Much as we see them as behaviors that are toxic, they are cries for help. So in recognizing that, I think we end up becoming a lot more compassionate, because otherwise we end up becoming judgmental. And when you operate from a space of compassion, it opens room for a discussion. It opens room for conversations to make people realize that there are impacts to the way their behaviors are playing out on the teams, right? The question is, who will bell the cat? I also understand that, because in organizations, there's power, there's politics, and there's power dynamics.
Yeah.
So that is a conversation to be left for another day.
Yeah.
But it is very important, therefore, and I've been recommending this and in my own way pushing for this in my organization, and hopefully we will make headway sooner than later. I think therapy is very, very mandated and mandatory for people in leadership positions, because a lot of our leadership style has to do with our unmet childhood needs and therefore trauma that seeks expression and addressal of unmet needs. So for a leader to do that self-work, access to a therapist and understand their leadership style, understand what's playing out, becomes very important, because otherwise you cut somewhere and you bleed elsewhere. And it becomes a bloody minefield and a bloody space of interaction at the workplace. Poppy.
Thanks. That's not an image I'm going to close this session on. So, but I totally agree with, and I think all of our stories and the way that we've talked about today, you know, if we don't do the self-work, then how do we lead, and how do we, and I guess it's not just about the workplace, is it? How do we be great family members? How do we pay it forward? So this is, I feel like it's a responsibility and also a real personal win to invest in ourselves, to do the work in terms of understanding who we are and how that then plays out. So look, on that note, I am going to thank you all. Thank you, just wonderful conversations. Thank you, Rajiv. Thank you, Mellener. Thank you, Mark. And thank you to the audience for listening and my team for pulling all this together. It's been great. And yeah, that's the end of this inside story. So thank you all, and I'll see you another time.
Thank you. Bye-bye.
Bye.